Welcome to today's Nutrition Subcommittee hearing. I want to thank everyone for taking the time to be here, and I want to thank in particular our witnesses for your participation. Also want to bring to your attention today's orange juice as compliment of Representative Ted Yoho of Florida. The Supplemental Nutrition Assistance Program, or SNAP, is by far the nation's largest federal food assistance program. Last year, we began a review of the past, present, and future of SNAP, holding 10 hearings at the full committee and subcommittee level. The review started from a broad perspective, but has narrowed in focus, examining such topics as the role of the charitable sector in fighting hunger and the use of evidence-based solutions to measure outcomes. One of the last hearings of 2015, we examined the effect of hunger on children, how they can break the cycle of poverty. In our first hearing of 2016, we're picking up where we left off by looking at challenges facing special populations. Seniors, veterans, and active duty military families each have unique needs. Speaking broadly, they are more vulnerable than many other populations to illnesses and physical and mental impairments that affect their ability to be fully independent. A simple trip to the grocery store may not be so simple if you're bound to maneuver a motorized wheelchair. Their ability to prepare food may be hampered by arthritis or an inability to stand for long periods of time. Climbing the economic ladder through work is not necessarily an available avenue to them. And yet under SNAP, they're treated under a one-size-fits-all model. Consider the makeup of the veteran population alone. As a member of the Veteran Affairs Committee, I'm well aware of the range of ages and abilities under this one umbrella. You have seniors who fought in World War II and Korea, baby boomers who served in Vietnam, and those who more recently returned home from Afghanistan and Iraq, and everyone in between. Some are in perfect health. Others face one or multiple diseases or physical or mental conditions such as Alzheimer's, arthritis, PTSD, or traumatic brain injury. And as more women answer the call to serve our country, that means women will make up a greater proportion of the veteran population. Given the diversity in the makeup of this population, one size cannot possibly fit all. As for active duty military, the USDA has estimated there are between 2,000 and 20,000 military families signed up for SNAP. However, a quirk in the eligibility calculation adds a needless complication to a family's decision whether or not to live on the base. The housing provided to a family living on a base does not count towards SNAP eligibility, which lowers their income and increases the benefit. On the other hand, the allowance that a family receives to live off a base does count toward eligibility, which raises their income and decreases their benefit. There are plenty of pros and cons that a military family must weigh as they decide whether or not to live on the base, but that shouldn't be needlessly clouded by whether or not they get a higher benefit from SNAP. Finally, the ranks of seniors are set to swell as the baby boomer generations enter retirement and health advancements help people live longer. Seniors have the lowest rate of SNAP participation of any demographic the program serves, but they also have the lowest rate of food insecurity, a low rate of food insecurity. However, doesn't give license to overlook the many factors that contribute to hunger among seniors, including a fixed income, illness, healthcare costs, specialized diets, and access to transportation. Before I close, I want to reiterate a theme that has been consistent throughout this entire review process. SNAP does not operate in a vacuum. SNAP alone will not end hunger, food insecurity, or poverty. SNAP is a piece of the larger puzzle. Everyone, the federal government, state governments, not-for-profits, the private sector, researchers, and recipients themselves have a role to play in lifting Americans out of poverty and up the economic ladder. Today, we'll hear from witnesses who can attest to challenges faced by each group and potential ways to lower barriers. I thank again each of our witnesses for being here and lending your expertise, and I look forward to hearing from you. I would now like to recognize Ranking Member McGovern for his opening statement.
Well, thank you very much, and I welcome the witnesses here today. This is the 10th hearing on SNAP, and some have wondered, to what end? Well, Speaker Ryan and Republican presidential candidates gave us the answer last Saturday at their so-called Forum on Poverty in South Carolina, and I have to say that I am deeply troubled. We've known for a long time that Speaker Ryan supports block granting SNAP. We've seen it year after year in his budgets. But if that's where all of this is going, that's bad news for poor people. And it's bad news for the vulnerable populations that our witnesses here today represent. Proposals like Speaker Ryan's to block grant SNAP would decimate one of the key features of the program, that it can quickly respond to an economic downturn, that when the breadwinner in a household loses his or her job, a family can quickly access SNAP to keep food on the table while they get back on their feet. After this last recession, there's good data emerging showing that SNAP worked as it was supposed to and expanded to help more families who needed it. And now that our economy is recovering, SNAP caseloads are declining and will continue to decline as the economy continues to get better. Simply put, SNAP is working. The Temporary Assistance for Needy Families, or TANF, on the other hand, which was converted into a block grant in the 1990s, barely responded to all the recession. In fact, we're seeing states shift TANF funds away from core anti-poverty purposes and instead using these funds to plug holes in other areas of their state budgets, leaving vulnerable families out of luck. The reality is that block granting SNAP would be catastrophic for the program. Funding would be capped, and states would either have to reduce the benefit, which we all know from the many hearings that we've held is already is inadequate, or they would have to cut people off. Either way, it would make hunger worse. And we know what happened with TANF, that states wouldn't have to use their SNAP block grant funding to actually feed people. States could use that money for just about whatever they choose. So we shouldn't change the entitlement structure of SNAP. Block granting SNAP is a bad idea, period. It would make hunger worse in this country, and I urge my colleagues to think twice about going down that dangerous road of block grants. Now, in terms of today's hearing, I see that the title is Past, Present, and Future of SNAP, Addressing Special Populations. Today's witnesses are among the most distinguished experts on senior and veteran hunger, but I think that we're only scratching the surface on special populations receiving SNAP. We should also be talking about the disabled, Native Americans, ex-offenders, and ABOBs, able-bodied adults with dependents. These are all groups that have unique and often complicated circumstances, and we should be focused on making sure that they have access to adequate food benefits. And I hope these populations will not be forgotten. But bottom line, if all of this is about block granting SNAP, or as Jeb Bush said, eliminating the food stamp program, then I would just respectfully express to my Republican colleagues and the leadership here to be prepared for a fight. If we have any function in this Congress, it ought to be making sure that the least among us are not forgotten or not invisible, and that we ought to be there to offer a helping hand. And again, I thank the witnesses and look forward to hearing your testimony.
Thank you, Mr. McGovern. I see the full chairman of the committee has joined us. The chair would now like to recognize Chairman Conaway for his statement.
Well, thanks, Chairwoman. I appreciate your holding this hearing. SNAP is a broad program. It's complicated. There are many facets to it. You can't brag on it or criticize it in a 30-second soundbite with any real granularity. And so unbundling the program to see its various parts and pieces, I think, has great value. And that's kind of what we've been doing. And so bringing you here today to help us understand the impact that SNAP has on the populations that you're the most involved with is important for the committee to help understand that. And this committee has made no proposals in changing SNAP, in spite of the ranking member's comments to the contrary. And so it's we're trying to learn, trying to understand it, because I'd be hard-pressed to say any program in government's perfect and works perfectly for everyone. If it can't be improved, that's a pretty tall comment to make, and I don't think you can make that about anything. So helping us understand the direct impact that these programs have on alleviating issues that your populations face day in and day out, in addition to hunger, is appropriate and good use of our time. So, Madam Chairman, I appreciate you doing the hearing, and I yield back that time.
Thank you, Mr. Chairman. The chair would request that other members submit their opening statements for the record so the witness may begin testimony. To ensure there's ample time for questions, the chair would like to notify members that they will be recognized for questioning in order of seniority for members who were here at the start of the hearing. After that, members will be recognized in order of arrival. I appreciate the members' understanding. Witnesses are reminded to limit their oral statements to 5 minutes. All of the written statements will be included in the record. I would like to welcome our witnesses to the table. Abby Liebman, President and CEO, Mazone, Los Angeles, California. Erica Tebbins, former military spouse. Vincent Ferris, Executive Director, Meals on Wheels of Johnson and Ellis Counties, Cleburne, Texas. Eric Schneiderwin, President-elect, AARP, Lansing, Michigan. Ms. Liebman, please begin with your testimony when you're ready.
Distinguished members of the Subcommittee on Nutrition and Committee on Agriculture, thank you for the opportunity to testify before you today. I am Abby Liebman, President and CEO of Mazone, A Jewish Response to Hunger, a national nonprofit organization working to end hunger among people of all faiths and backgrounds in the United States and Israel. In response to learning that a startling number of our partners were providing food assistance to a growing number of military families and veterans, Mazone's Board of Directors made these issues a core priority for our education and advocacy. After an exhaustive search for accurate data from government and private sources, we learned the following. First, we found that literally hundreds of thousands of veterans are experiencing food insecurity without receiving assistance from SNAP and other available benefit programs. Food insecurity among veterans, old and young, is nearly double the prevalence of food insecurity and very low food security for the general U.S. population. Second, we also uncovered serious indications of food insecurity among currently serving members of the military. The causes? Low pay among lower-ranking enlistees, high unemployment among troop spouses, larger household sizes, challenges around activation and deployment, and unexpected financial emergencies. How do we know this? In addition to reports from our colleagues operating food pantries, Mazone learned from a source at the Pentagon that there are food pantries operating on or near every single naval and marine base in the United States. There can be no denying that food insecurity among military families is real and a painful reality. The experiences that Erica Tebbins will share with you today provide insight into just what those realities look like. There are three important actions that we urge Congress to take now to begin to address this growing problem. Demand more data. Despite strong anecdotal evidence, food insecurity among military families is not adequately documented or monitored by government agencies. What data we have been able to secure are often contradictory, out of date, or simply incomprehensible. No one really knows the military and veteran population numbers for government nutrition programs, let alone the estimates for the true level of need in these populations. Accurate data is essential if our nation is to better understand the scope of food insecurity among military families and allow us to find the gaps and provide meaningful solutions. But make no mistake, if even one military family goes without adequate nutritious food, this nation is not meeting its responsibility to those who serve our country. But of course, data alone is not the answer. You must remove policy barriers. Federal policies are actually denying struggling military families the resources they need to prevent food insecurity. Including the basic allowance for housing as income when determining SNAP eligibility is not only inconsistent with its treatment by other federal programs, it has made thousands of struggling families ineligible for vital SNAP benefits. In order to survive, they must turn to food pantries on and off military bases. The BAH is not included as income for the purposes of calculating income taxes and eligibility for WIC and Head Start. The BAH should be consistently excluded as income for the purposes of determining eligibility for all nutrition assistance programs. We urge agency collaboration. For veterans, this is not only essential, it is becoming a matter of life and death. A growing number of veterans, particularly disabled veterans, are caught in the middle of bureaucratic delays and federal agency silos, unaware of or unable to access nutrition assistance benefits despite their obvious need. For veterans awaiting a disability determination, delays and multiple peers are commonplace and last for almost a year in some communities. During this time, these men and women are unable to access nutrition assistance benefits and literally have nothing to eat. What can we do? We can start by ensuring that the government agencies charged with their care actually communicate with each other. VA social workers can use a simple two-question food insecurity screening tool and refer those who screen positive to resources that support access to adequate, healthy food, including SNAP. But perhaps the best way to prevent hunger among veterans is to protect and strengthen the SNAP program. Right now, an estimated 60,000 veterans face the loss of SNAP benefits because of the expiration of the time limit waiver for ABODs. Cuts to SNAP hurt millions of Americans, including military families and veterans. This reality of limited data, unfair policy barriers, and bureaucratic silos comes at a time when the need among military families and veterans has never been greater. It's up to you to make the changes that will make this reality and less impactful on their food insecurity. If not now, when? If not you, then who? Thank you.
Thank you, Ms. Liebman. Mrs. Stebbins, please proceed with your testimony.
I would like to begin by thanking all of you for taking the time to hear my testimony and for Mazone for working on this important issue and giving me this opportunity. Being able to speak on behalf of active duty military families who may be too afraid to speak out on this matter is a great honor, and I hope my story can help them. In 2003, my ex-husband Colin was assigned to his first naval duty station as a culinary specialist at the Bremerton Naval Hospital in Washington. I was leaving my job as a high school teacher and a master's degree program just 2 courses short of graduating. The job prospects in our new town were bleak, and I was constantly told that I was overqualified in interviews. I finally managed to secure employment in 2 positions, as a bank teller making $9 an hour and as a baker at a diner making $10 an hour. I was working 35 to 40 hours a week, but still only making half of my previous salary. Then in March 2004, I found out I was pregnant. A coworker mentioned the WIC program to me. I'd never heard of it, and I thought it absurd a military family would qualify for any type of assistance, especially because we weren't the lowest rank of enlisted personnel. Colin was an E4, which is quite good for someone with less than 2 years of service. When they told us our family qualified, they also told us that many military families are eligible but don't realize it. How could this be? I was quite embarrassed, but had to accept both the help and the disapproving glares when handing over my vouchers at the grocery store. All this time, I was continuing to apply for a job with better pay, but continued to be deemed overqualified, and it didn't help that I was also very visibly pregnant. Our son Jack was born in November 2004. He had to be delivered via cesarean section, meaning I was not allowed to go back to work for 6 weeks. When I was medically cleared for work, I could only take shifts on Saturdays when Colin could watch Jack. We had no family locally and could not afford childcare. This is when things got incredibly difficult. We went to the Navy Marine Corps Relief Society for advice, and their only recommendation was that we apply for a low-interest credit card called Military Star. Taking on more debt did not seem like a reasonable solution. With a lot of shame and reluctance, I applied for SNAP benefits. When we were denied, I was devastated and confused. I felt like we were doing everything right, but we were still stuck. I also didn't understand why we would qualify for one government food program, but not another. My husband and I shared one used car and had no cable or other amenities. We kept a vegetarian diet because we couldn't afford to buy meat. I exclusively breastfed Jack until he was 6 months old too, which saved us the expense of formula. I was also forced to defer my student loan payments, but that only prolonged the debt. The stress that this financial burden caused was profound and constant, and was amplified by the stress of caring for a newborn. The problem was our basic allowance for housing, or BAH. In the SNAP application, BAH was being included as income, despite the fact that the WIC application specifically excludes it, and both programs fall under the USDA. When we moved, there was no military housing available to us, so we were forced to rent an apartment. We intentionally chose an apartment where our BAH would cover both the rent and the utilities. BAH is calculated by the local cost of living and varies greatly across duty stations. Since we lived in a high cost of living area, this inflated our gross income substantially. This is why we were denied essential SNAP benefits and why many military families are also denied. On paper, it appears these families are economically stable, when in reality, they might not earn enough to support their children. I feel it is an oversight as part of the application process because I could not imagine that legislators would ever consciously want members of the military and their families to be food insecure. Thankfully, I got a great full-time job when Jack was 18 months old, and we were able to leave the WIC program. We haven't needed it since. We are lucky, but that doesn't change the fear, stress, and panic we felt during the first 18 months of my son's life. Being in a military family is challenging. We have to make so many sacrifices. Missed time with loved ones, not having a constant place to call home, job security for dependents, and so much more. One thing military families should never have to worry about is having enough food. I sincerely hope you will consider revisions to SNAP for military families because they deserve to be taken care of by the country they serve. Thank you for your time.
Thank you, Ms. Stebbins. Mr. Ferris, please proceed.
Madam Chairwoman, distinguished members of the subcommittee, thank you for the opportunity to be here with you today. In addition to leading Meals on Wheels of Johnson and Ellis counties, I also have the honor of serving as the immediate past board chair of Meals on Wheels America. All told, there are more than 5,000 senior nutrition programs throughout our country, all unified in a mission to support our community's most vulnerable seniors to live safely, healthfully, and independently in their own homes. Today, we are challenged like never before in addressing the growing needs of a rapidly aging population that is increasingly struggling with hunger and paying for basic living needs like rent, utilities, and prescriptions. Take Emily, for example, whose story is similar to the thousands of seniors in your states and districts who are significantly at risk of hunger and isolation. Emily is 92, a retired nurse who worked for 40-plus years and receives about $850 a month in Social Security benefits. She suffers from severe osteoporosis and is physically unable to leave her home to go to a grocery store or stand to cook and prepare her own meals. Emily relies on a Meals on Wheels volunteer to bring her a nourishing hot meal every day. This friendly visit and personal connection is the only human contact Emily may regularly have. Like most Meals on Wheels clients, the nutritious meals Emily receives help her to maintain her independence, to live in her own home, and to avoid unnecessary trips to the hospital. Meals on Wheels offers her a lifeline that is a much preferred, economical, and common sense alternative to other long-term care options. As you know, the consequences of hunger and food insecurity are both socially and economically profound. For seniors, even a slight reduction in nutritional intake can exacerbate existing health conditions, accelerate physical impairment, impede recovery from illness, injury, or surgery, and increase the risk of chronic disease. Today, 1 in 6 seniors struggles with hunger, and those experiencing very low food security has increased 63% between the start of the recession in 2007 and 2013. Findings from a recent study showed that seniors on Meals on Wheels waiting list are among our nation's most at-risk and vulnerable populations. Specifically, these seniors were more likely to report poorer health, higher rates of anxiety and depression, and fall more frequently. 87% of these at-risk seniors required assistance with grocery shopping. It is imperative that proven and effective programs designed to meet the nutritional and social needs of special populations, such as seniors like Emily, be further strengthened. Any legislative and policy changes should enhance nutritional access and assure individual safety, security, health, and well-being. We can either invest a modest amount in proper nutrition for our seniors now or spend significantly more on the adverse consequences that will increase health care costs later. Accordingly, we urge consideration of the following. First, protect and support SNAP. On average, seniors on SNAP receive only $129 a month. However, it can mean the difference between having to choose between meals or prescriptions. SNAP must be supported and recognized as a critical pillar to reducing senior hunger. Second, reauthorize and support the Older Americans Act. The Act has been the primary piece of federal legislation supporting social and nutrition services for older Americans since 1965. Despite the Act's longstanding bipartisan, bicameral support, it has been unauthorized since 2011 and remains woefully underfunded. Third, modify Medicare and Medicaid to meet the nutritional needs of our most vulnerable. It is notable that a senior can receive Meals on Wheels for an entire year for about the same cost of 1 day in the hospital or 1 week in a nursing home. Accordingly, we recommend that Medicare and Medicaid plans include coverage for home-delivered meals prepared and delivered by private nonprofits with physician recommendations. The time to act is now, especially given the magnitude of the senior hunger population, coupled with our rapidly aging population. The good news is that the infrastructure already exists to meet these challenges through successful programs administered by USDA and HHS. Working together to ensure that no senior in need struggles with hunger and isolation is an investment in our nation's fiscal future, and it is also a preventative prescription for significantly reducing Medicare and Medicaid expenses. This is an issue that is not only within our reach to solve, but it is also the right thing to do for all of the Emilys in our communities. Thank you.
Thank you, Mr. Ferris. And Mr. Schneiderwin, please proceed with your testimony.
Chairman Conway, Subcommittee Chairman Walorski, Ranking Member McGovern, and members of the subcommittee, thank you for holding today's hearing on SNAP and for inviting AARP to speak about the program's positive impact on older Americans. My name is Eric Schneiderwind, and I am the AARP President-elect. SNAP is a critical part of the nutrition safety net now available to low-income families and people in need, including the elderly and people with disabilities. It is exceptionally effective and efficient at reducing food insecurity. Program performance is better than it ever has been, with over 99% of participating households meeting all the program's eligibility requirements in fiscal year 2014. Along with helping low-income persons eat healthier, more nutritious food, SNAP also helps stimulate the economy up to $9 for every $5 in SNAP benefits spent, an economic effect that was part of the program's design. While SNAP is at the cornerstone of all public food assistance, other programs under the subcommittee's jurisdiction also address senior hunger in tandem with the vast private charitable network that assists seniors every day. Programs such as the Commodity Supplemental Food Program, the Emergency Food Assistance Program, the Senior Farmers Market Nutrition Program, as well as home-delivered and congregate meals authorized under Title III of the Older Americans Act, serve millions of seniors. But there is no replacement for SNAP when it comes to fighting hunger in all population groups, and older Americans are no exception. I would like to take a moment to recognize Lisa Marsh Ryerson, President of AARP Foundation, a charitable affiliate of AARP, and to thank her for being here today. According to Foundation research, the younger segment of older Americans is often at deeper risk for food insecurity than their older counterparts. Even if they have specialized needs or limitations, they might not qualify for other nutrition assistance programs geared toward older Americans. However, low-income seniors face problems that their younger counterparts do not, namely, reduced ability to re-enter the workforce, fixed incomes in retirement, and significantly higher medical costs. Seniors struggling with food security were over twice as likely to report being in poor health. Health care for someone over 65 costs 3 to 5 times what it costs for younger people. And researchers have recently discovered that severely food insecure individuals required an average of $4,000 in care compared to $2,806 for moderately food insecure individuals and only $1,608 for food secure individuals. As the senior population grows, food security issues will continue to pressure the public and private healthcare system. For many seniors, food security can mean better management of a range of chronic diseases. Given the costs of chronic disease management to the healthcare system, and particularly programs such as Medicare and Medicaid, we believe that there is a strong incentive for policymakers to look at hunger as a health issue. It can be key to bending the cost curve, especially for seniors. SNAP benefits help recipients afford other necessities, such as housing and utility expenses. There may also be a positive effect on other health-related problems associated with food insecurity, such as postponing needed medical care, delaying or not taking prescribed medications, and increased emergency room use. By providing SNAP benefits to individuals in need, we can help people live at home and age in place, helping to delay or prevent more costly institutional care and unnecessary hospitalizations. This saves taxpayer dollars because caring for people in their home costs about 1/3 of the amount that institutional care costs, and it is the option that is overwhelmingly preferred by the recipients. Seniors participate in SNAP at a lower rate than any age group due to both societal and policy-related barriers. However, promising practices can remove barriers such as arduous application length, confusing medical expense deductions, asset tests, and in-person interviews for initial benefits and recertification, which are difficult for homebound individuals. In Chicago, the AARP Foundation launched a mailer encouraging SNAP registration in targeted areas to link recipients with fresh fruits, vegetables, and proteins. The foundation is also connecting fresh food supplies into food deserts, providing both application assistance and an ability to more easily use those funds on nutritious foods delivered into the community.
Mr. Scheinman, I'm afraid you're out of time.
May I finish with my conclusions?
Speedy.
We recommend that Congress refrain from making any further benefit cuts and avoid making any structural changes that would weaken SNAP's ability to respond to increased needs due to economic changes. We recommend that you resist expanded work requirements, particularly on workers 50 plus, who typically take longer to find new permanent employment after being unemployed. We ask you to continue to protect categorical eligibility, as in the last Farm Bill, which is essential to improving access to SNAP for low-income Americans of all ages, and that you invest in community-based initiatives to assist older adults and other vulnerable populations in better managing chronic conditions. You should simplify the application process, lengthening recertification periods, and provide additional incentives to states to expand eligibility.
Mr. Scheinman, I'm going to have to cut you off there in deference to all the other witnesses, but I appreciate your testimony.
Thank you.
Absolutely. Ms. Liebman, I wanted to direct my question to you. In addition to sitting as chairwoman of the subcommittee, I also sit on the House Armed Services Committee and the Veteran Committees as well, so I know all too well, how the VA system is broken in so many ways. But in situations where there's delays in VA benefits, which is often for thousands of people, can SNAP be useful because of how quickly it can absolutely be brought into the system? And then can you just kind of talk to the fact of how SNAP is kind of used as a bridge in some of these situations?
Absolutely. The concept of having adequate food is an important part of the healing process for people and helps them get back up on their feet. So obviously, the more quickly people can access those benefits, particularly people who are struggling with disabilities when they return from being mobilized, the better for them. And one of the consequences of the way in which the system's currently working at the VA is that not only are they having delays, sometimes they're not even asked about whether they can qualify, given opportunities to apply for the benefits themselves. And in thinking through the relationship between what the social workers, the medical professionals are being confronted with when someone comes in the door of the VA, they need to really address whether or not these people are struggling with food insecurity. They don't even ask. So I think at the outset, if they're asked about that, there'll be a move in the direction of getting them application assistance, which again becomes a secondary issue because sometimes the application process itself is very onerous, and as I said, it can result in terrible delays. So expediting that process for veterans who are seeking qualification as disabled would do tremendous good in helping them to recover.
I appreciate it. And then just quickly, Mr. Ferris, the Meals on Wheels program in my district is phenomenal in the South Bend area that serves a regional area and really one of the models, I think, for a lot of the Midwest. I'm just curious, though, what are some of the impediments to seniors actually seeking out benefits, that generation of senior citizens? And it seems like it's so disproportionate. Such a tiny amount of seniors actually reach out, yet they're so far on the list of food instability. What are some of the impediments that you've seen? Because Meals on Wheels is a revolutionary program that works hand in hand with SNAP. So I guess twofold, what are some of the impediments from seniors reaching out? And then secondly, do you see SNAP as a program that's been an easy partner with and perhaps, more organizations coming alongside?
Yes, ma'am. One of the most difficult task that Meals on Wheels organizations have in trying to encourage when we see needy individuals who could certainly benefit from the SNAP benefits, is getting them to truly understand it. And what we're dealing with here is egos. They are not looking for a handout. They don't want to get too far out in front. They're proud people. That is first and foremost in it. One of the other things, they think that the process is difficult, and when they have all of the life challenges bearing down on them at this advanced stage in life, it's like more than they can handle. They think it's an onerous process to go through. And probably thirdly, I would say that they think the benefit is too small. Most of them think they're not going to get anything. There's probably some out there that would think that they would be taking benefits from other people as well. It has been a difficult program to work with for a lot of Meals on Wheels organizations. Speaking from our own, it is not as easy to get people signed up as it could be and should be. We would like to see a much more streamlined process.
Thank you, I appreciate it. And Ms. Liebman, one final question. I'm back to VA, because I'm thinking about casework that comes into our offices, all of our offices, congressional offices around the country, and issues with, delays, patient care, applications, phenomenal delays in disability assessments and those kinds of things. So when we're talking about, for example, if we made a move and we said, we want to focus a lot more on these SNAP benefits toward veteran organizations, I kind of cringe when I think about asking the VA to do one more thing, because so many of the things that are happening are not done correctly. So if we were looking at a way to expedite that process or something like that, would this be something that we would work more on the USDA end in making sure those connections are timely and efficient and that type of a thing, not just handing this over to the VA and having them reach back to the USDA? How does that something, and then we're almost out of time, but maybe I can talk to you about it afterwards to at least plant the seed. How does that work?
And the good news is that the VA and USDA have begun a dialogue in which they are talking exactly about these issues, that they're demonstrating extraordinary leadership and innovation and trying to find ways to work together to resolve some of these issues. So I think the movement forward has begun, and the support from Congress to see that happen is probably essential.
I appreciate it. And I want to yield, Mr. McGovern is yielding to Ms. Adams, 5 minutes.
Thank you very much, and thank you, Madam Chair, and Ranking Member McGovern, thank you, and to all of our guests, thank you very much. Of the 6 counties that are represented by my district, the 12th in North Carolina, the Department of Health and Human Services estimates that 25,000 or more able-bodied adults without dependents will be impacted by the reinstatement of SNAP work requirements. It includes over 10,000 adults in Mecklenburg and 8,000 in Guilford, where I live. And a able-bodied adult can continue to receive SNAP benefits only if they enroll in an employment and training program, but most counties do not have the funds necessary to meet the federal matching requirement for a SNAP employment and training program. Ms. Liebman, you mentioned in your testimony that ABAWD work requirements will impact 60,000 veterans nationwide. Where have you seen success in connecting ABAWDs to job training programs that allow them to continue receiving SNAP benefits?
I'm actually personally not aware of any stellar, outstanding programs that have certainly been focused on moving veterans through the employment training system, and when they're also in the category of ABODs, into gainful employment. But that is not a focus or an emphasis of what Mazone does, so it's possible those programs exist, but it is not something of which I am aware.
Thank you. Mr. Snydewin, my office is currently drafting legislation that will strengthen the SNAP program and make the standard medical deduction permanently authorized. This is going to allow seniors and the disabled to include their medical expenses when they apply for SNAP benefits without having to itemize every out-of-pocket purchase they make just to receive more adequate SNAP benefits. Nationally, how much do you see the medical expense deduction being underutilized by seniors and the disabled due to the lack of a standard medical deduction in all 50 states?
Well, I don't have estimates of that precise element, but I can tell you that seniors apply for SNAP at a rate almost one half of the other populations. And we have found that very complicated requirements for application, frequent recertification, requirement for many people to leave their home when they don't have mobility to make application, all of these factors have deterred or discouraged seniors from applying for those benefits. So we believe some of the complexities and the requirements in eligibility need to be simplified and certainly reduced to increase participation of seniors.
Thank you very much, and I want to thank all of you for your testimony. And Ms. McGovern, I thank you for yielding, and Madam Chair, I'm going to yield back my time.
Thank you. I now yield to Chairman Conaway, 5 minutes.
Thank you. And again, thank the witnesses for being here. Mr. Ferris, you mentioned that most Meals on Wheels programs had waiting lists or backlog lists.
Yes, sir.
Can you walk us through why that's the case? And would all of those folks already be on the SNAP program? And then give us the mechanics of how SNAP interrelates with the Meals on Wheels. In other words, do you get payments from SNAP? Help us understand the program as to why there are backlogs.
In the Older Americans Act nutrition programs today, there's a significant smaller number of meals being served annually than was what was being served 10 years ago. We are serving actually 21 million fewer meals this year than in 2005. One of the big challenges that we have out there is that funding for the Older Americans Act has not kept pace with the growth in the population.
And that's where the funding for Meals on Wheels comes from?
That's where the large part of Meals on Wheels funding comes from.
Do you get funds from the SNAP program as well?
In Texas, in our program, we have great difficulty utilizing SNAP. We should be able to, but we do not have the ability for the electronic funds benefit cards. So what we do
is that a restriction on your side or on the state side or the Fed side?
It's difficult working with the state.
Okay. Okay.
So what we do is encourage the clients out there, the participants, recipients, needy seniors, to be using their SNAP benefits for other necessities there at the grocery store.
All right. And the backlog is caused by just the funding shortage?
That's the biggest problem.
Ms. Tibbins, thank you for your story, and I appreciate that. Ms. Liebman, thank you as well for your work you're doing. Other than the basic housing allowance, which it is hard to justify the differential between the treatment, that is clearly something we will address. Are there other things that stand in the way of getting these veterans the help they need, or the active duty folks the help they need?
Yes, sir. Excuse me. The difference between qualifying for SNAP and becoming food secure is something that I think the committee and Congress should pay attention to, because the support of SNAP is essential to allowing people to have some support for purchasing power with regard to groceries. But it doesn't mean that these individuals have become food secure in their households. So some of this has to do with the complications that come from moving from state to state when they are deployed from one place to another. So there's a lack of consistency in the ways in which people apply for benefits in states, that the rules can change, the qualifications for them can change. There are issues for them with regard to emergency financial situations that come up. So some of this is not uncommon to other parts of the population, but in a military context, there is less support for addressing some of those needs, in part because of stigmas attached for seeking assistance, and then access to those programs and benefits that may or may not be close to base or where they're stationed.
Okay. Mr. Ferris, you mentioned that 92 lady in your testimony. Thelma? What was her name?
I beg your pardon?
The lady you mentioned, her name?
Yes, Emily.
Emily, excuse me. Is there a part of your program that tries to engage families? In other words, just Emily has no family at all. I seem to treat, we've got to get families involved. Is there a way that you guys look at that to try to augment the support for these folks that get contact other than just the Meals on Wheels?
We try as hard as we can. What we are seeing now in individuals like Emily, so many of them are outliving their families and their friends, and families that they do have left are too many generations down, and they have lost interest, and so it's very difficult. We do everything we can to try to get them involved. Yeah.
Are there legal barriers that we need to address that prevents you from actually doing a better job of that?
I'm not aware of any legal barriers, no, sir.
Okay. Again, thank you for helping us understand these special populations, and we'll continue to work to improve these programs. This is among that group that very few folks among us would say we shouldn't be trying to help. Probably have a difference of opinion on the able-bodied adults with no dependents, but certainly the folks that the majority of the folks you guys represent are a population that all of us have a heart for, and we try to figure out how to do that better. Thank you for the work you do as advocates, and with that, I yield back.
Thank you, Mr. Chairman. I now yield to Congressman McGovern.
Thank you. Well, first of all, let me thank you all for your testimony, and you all were incredibly eloquent. But I have to say that your testimony is sad. We live in the richest country in the history of the world, and we have a big chunk of our population that doesn't know whether they could put food on the table. People who are hungry, and I think we all should be ashamed of that. And I think that reflects a failure of government to respond adequately. And we have nothing but praise for charities, but let's be honest, charities can't do this alone. And I've advocated for some time that the White House put together a White House Conference on Food, Nutrition, and Hunger to connect the dots. Ms. Liebman, you talked about the conversation going on between the VA and the USDA. That's encouraging. But there needs to be conversations amongst multiple agencies and departments, not only on the federal level, but federal, state, and local level, with the private sector, with charities, with food banks, with organizations like AARP, and all the different groups out there that have anything to do with this. And Mr. Schneiderwin mentioned that hunger should be treated as a health issue, and I think I agree with him. But the problem around here is that the budget for SNAP doesn't come out of the budget for Medicare or Medicaid, and so we're not very good at saving money over here if we have to spend a little bit over here. And I began by expressing my concern about what happened over the weekend in South Carolina. I just want, for the record, see, does anybody here think that it's a good idea to block grant SNAP?
No.
Okay. All right. And based on what the testimony, not only from those of you here, but from the other hearings we've had, the benefit that currently exists seems inadequate to be able to get people to a point where they're no longer food insecure. In other words, most of these people who get on SNAP have to rely on other programs as well, or go to food banks or food pantries. So does anyone here think that the benefit is adequate?
No.
No.
Okay. I appreciate your direct answers. My colleague, Ms. Adams, raised this issue of ABOBs again, and I think they tend to get a bad rap. And just make it clear for my colleagues, these are people, we're told that in this year that up to 1 million of the nation's poorest adults who fit into this category will be cut off of SNAP as a 3-month limit on SNAP benefits for unemployed adults who are not disabled or who are not raising minor children. Returns in many areas, and I think a lot of people don't understand that the very difficult circumstances that some of these people face. Now, up here, when these so-called reforms have been put into place, I mean, no one in Congress is on food stamps. No one's on SNAP. And so it sounds like a reform. Oh, we'll incentivize people to work, or we'll incentivize people to get job training. But one of the realities is that many of these poor individuals who will be cut off are veterans, and they've honorably served our country, and some of them are now deeply struggling. Ms. Liebman, if you can just talk to us about the overlap between the veteran population and ABOBs, I think that would be very helpful.
Yes, there is a significant overlap, obviously. I mean, I referenced the notion that there would be 60,000 veterans is the best estimates that we've been able to gather that would lose their benefits when the time limits are no longer implemented, when they're now going to have time limits on when they can get SNAP. And the challenges that they face have to do with having adequate access to training programs, which Congresswoman Fudge referenced, and there is a program in Washington State that my colleague reminded me of that is, in fact, an efficacious program. So there's a model to look to. But there have to not only be enough slots in those training programs, the training programs have to be meaningful, they have to be relevant to the job market in that particular community, and then there have to be jobs available.
Right.
And not all of that can come together at the same moment and the same time for everyone who's looking. And for veteran populations that may then have to become mobile, that is, they'd have to move again to look for work and start over again. And during all this period of time, they're no longer getting benefits, so they're no longer able to sustain themselves.
So
there's a
these
vicious
people
circle.
are not, lazy. They're not,
No.
they're not content at just being on SNAP. I mean, they would like very much to have a job, but because the situation is a lot more complicated than sometimes we make it, the situation that they face right now is that they may lose their benefit.
That is correct. Nobody has an easy or comfortable life living on government benefits. It is not a boon. It is, in fact, a very limited existence, and one which virtually everybody on the program who is not currently employed, of which a huge percentage are, of course, is seeking a way to get off of government benefits, unless, of course, they are in a position where they are so vulnerable that they cannot find a way to get revenue in any other way. And then we need to find other programs that help to support them.
Thank you.
I now recognize Congressman Thompson. 5 minutes.
Chairwoman, thank you so much for this hearing. I want to thank you and thank Chairman Conaway for, despite some of the things you might have heard, there's no preconceived conclusions here. We're having an honest dialogue, just like some other folks had an honest dialogue over the weekend. And in that dialogue, we're going to hear different ideas. Some we may agree with, some we don't. But the same, unless we can have that dialogue, I think, because we're not going to achieve our objective of making sure these are the best possible programs to meet the needs of folks that are out there. These are important issues to me. 30 years ago, my wife and I were starting out with our family, first child. We were on the WIC program, Ms. Stebbins. I remember how uncomfortable back then we were taking those vouchers to the local IGA. But how important that was in terms of ensuring that my wife and our unborn and then newborn son, Parker, who's now a 31-year-old pastor, was able to get the nutrition that he needed to be healthy. I'm a military dad. I have a son and a daughter-in-law. The daughter-in-law is out of the Army now, but I'm well aware of the military food insecurity, especially for those folks who when they go into the military, they're maybe a little older and they've got a number of kids, just at E1, E2, E3. It's challenging, and I'm glad I'm hearing good ideas here of what we need to do. I'm a former therapist and a licensed nursing home administrator, so I know that senior nutrition is about senior health. It's about independence, and so I'm glad. Look forward to working on the Older Americans Act as with that. But I wanted to focus on. I'm also a proud member of the Howard Area Lions Club, and we maintain a food pantry. There are many different ways we attack hunger and nutrition. SNAP is a supplemental nutritional assistance program. It's not meant to be the end all. I remember when we were getting back when we needed and were eligible for the WIC benefits, we also regularly got bags of groceries every time we left my in-laws. My mother-in-law packed the bag, and my wife and I still reflect back on that, how important family was during those times. With our Lions Club, we have a food pantry, but we also do something. I don't know if a lot of food pantries do this or food banks. Our members deliver, not everything, but there are folks who just they can't travel. They live in remote areas. They have difficulties with transportation, and it seems to me it's really kind of interesting as a former healthcare person and a rehab person. I just see the value in that because of what they see. It's contact that they have. These folks have. They're living by themselves normally, a little more isolated, and they get to see things. They may recognize health changes. They may talk about other needs. And so my question for you, really centers around that. We've heard from various witnesses in our review of the SNAP that every person's circumstances are different, and the best way to help a person is when you work with them to address their challenges from a holistic perspective. How does the personal connection, the person delivering the meals, makes better enable you to assist them with their needs beyond food assistance? And what sort of challenges are you able to recognize that one might not see if the groceries are simply left at the door? And for anyone that would like to take that question on, I appreciate it.
I'd be happy to.
Maris?
Congressman, thank you very much. Every situation is unique, and in the world of Meals on Wheels, we try to address each situation as uniquely as we can. The majority of the folks that we see are homebound, meaning they have difficulty getting out of the house easily. Some of them, though, that are able to take a parcel of food like you're talking about there in the box and still able to do something with that, prepare their meals. Some, though, as I mentioned in my remarks about Emily, don't have the ability to stand for long and prepare that meal. So it all depends on the individual situation. We start out with having a case manager go out and take a look and just general observation as to what's going on in the house and what the person's needs are, and try to get our best assessment on that. It's followed up either by volunteers delivering the meals once they begin service, or maybe paid staff in some cases, but just ongoing observations, because things change. We're talking about a rapidly aging population, and things can change in the blink of an eye. Health can definitely turn when we least expect it. The volunteer checking on that person daily can observe that. Their cognitive skills may not be what they were. They may not be recognizing the person coming to the door like they were. Their appearance may have changed, and so we can get back. Chairman Conaway was asking about families. In cases where there are still families involved, we can pass that on to them or to other caregivers along the way, and hopefully there would be caregivers there. It could be a safety issue. There could be a smell of natural gas or something like that in the house. When you just have a box delivered to the door, that is not the exact same thing.
Yeah, thank you very much.
If I could add, Congressman, the notion that charity helps to support the government programs is an important concept. It's an important partnership, but it's the government programs that provide the kind of consistent, stable, and baseline support that these families need. And that charity alone could never be responsive enough. In fact, I'm sure as you're aware, the pantries that provide assistance to families do so on a very irregular basis, meaning that you may be able to come in for groceries on one day, on a particular week, and then not again for another month.
Cut you there, sorry. Chair recognizes Congresswoman Delbene.
Thank you, Madam Chair, and thanks to all the witnesses for being with us today. We really appreciate your time. I want to note, since we're discussing the needs of veterans as part of today's hearing, I recently was volunteering at one of the food banks in my district at HopeLink, and in my district, 40% of food bank client households have at least one person currently serving or who previously served in the military. And this number goes up to nearly 58% in King County in Washington State, and at least 62% in Snohomish County. And as part of that, Madam Chair, I wanted to ask unanimous consent to insert into the record a letter from Food Lifeline, which is an organization fighting hunger in our district that elaborates on this even more. Thank you. I also wanted to go back to some of the discussion we've had on able-bodied adults without dependents and the cliff that we see when folks are unable to find employment programs or unable to find work. As we talked about earlier, nationwide, the ABOD cliff includes 60,000 veterans, 60,000, and according to the Center on Budget and Policy Priorities, over 40% of this vulnerable population are women. Close to 1/3 are over the age of 40, about half are white, 1/3 are African American, and 1/10 are Hispanic. And we know that Native American populations will also be hit hard. I helped introduce legislation, the SNAP Work Opportunities Act, that would provide an exception to the 3-month time limit for those looking for work in states that don't have the resources to offer them job training or workfare opportunities, and was noted, thanks to Ms. Liebman for pointing out, we've had a lot of work in my state of Washington on SNAP employment and training, education and training efforts, and we know that there are pilots now that we helped start in the last Farm Bill that will continue to hopefully come up with great ideas of how we can use SNAP ENT to, again, help folks not need SNAP programs anymore because they are able to find jobs that allow them to be self-sufficient. But I wanted to hear more broadly from everyone on the panel today about how the cliff, the ABOD cliff, will hurt populations that you're representing. 'Cause I know, Ms. Liebman, you talk a little bit, but are there others who can tell us a little bit more about how this has affected some of the folks that you've been working with?
Well, we at AARP at least know that there are potentially 1 million people affected, and it's serious enough so that we are looking at it and believe it may need a revision, and that work will go forward to take a careful look at it.
Mr. Ferris?
One of the challenges we have is that once a senior hits the poverty level, it's very hard for them to climb out of that poverty level, and work opportunities are not there. And we're talking about able-bodied seniors here as opposed to those that are homebound. It is very, very difficult for those that are needing work at that age when
Thank
it's
you.
not available to them.
Thank you. Mr. Schneiderwin, in your written testimony, you ask for Congress to keep work requirements for SNAP at their current level. Can you elaborate on why you've made that suggestion in your written testimony?
Well, pretty clearly, right now among seniors, as I've said, the participation rate in SNAP is already quite low, in the 40% range versus 80% range of otherwise eligible people. So we think that any heightened work requirements would further reduce the participation. And really, it's critical to keep an increased participation because this is really a health and a healthcare cost issue. If we can keep people in their homes through SNAP benefits, they may then avoid institutional care, which can cost Medicare and Medicaid almost 3 times, particularly Medicaid, 3 times the amount that you would have to pay to keep them in home. And that's where they want to be, is at home. So we think that really the requirements should be liberalized rather than tightened, because this is a program that can save taxpayers money through reducing institutional care.
Thank you. Thanks again to all of you, and I yield back, ma'am.
Thank you. Chair recognizes Congressman Gibbs for 5 minutes.
Thank you. Thank you all for coming in to help enlighten us a little bit how these programs work and what the challenges and struggles are. I've really been, hearing Ms. Tevins talk about your experience, and thank you for your service, your family service. Can you elaborate on why some military families choose to live on the base versus off the base? Is there a difference in cost? Can you just explain?
Yes. So when we first moved to Washington, I was under the impression that since the military is moving you and the military has housing, that housing would just be a given. You would just show up at the housing office and they would tell you where you're living and that would be it. But I came to find out that at most military bases, there's actually quite an extensive wait list. Could be 6 months to a year, could be even 2.5 years, very, very long. So in those instances, you are forced to rent. And so, the housing office does have binders and stuff there that you can look through of local properties and such. So when we started looking around, we knew how much we would be getting in BAH. And so we specifically chose an apartment that would be, the monthly rent would be far enough under our BAH that the difference would also be able to cover our utilities so that it would kind of be flush. And also, there was some money. We were moving from Arizona, and so we kind of had to set up all of our military move stuff through the local Air Force base, which was really odd and difficult. And so when we moved up there, we actually had no idea that you're supposed to get sort of a front of money before you move each time to help offset some of the costs. And because we didn't know to put in the proper paperwork for it, we didn't actually get any of that. So when we got the apartment, we actually had to ask my parents for a last-minute loan just to pay first month's rent and deposit.
Okay, so we need to figure out what's going on there to help
Right, yeah.
facilitate that. Okay. And Mr. Ferris, through the multiple hearings we've had, we've talked quite a bit about the challenges in rural America versus the more populated urban areas when addressing hunger. And people would, I think just normally assume that if you live in an urban area, you have more access to grocery stores in close proximity. But however, we've learned that that's not always might be the case. And can you maybe elaborate, the difference might be living here in Washington, D.C. versus living in my rural county back home in Ohio, some of the challenges you face as an organization, and what similarities are fighting hunger, and then also the challenges
Yes, sir.
in rural and urban.
First off, we know that seniors living in rural areas are going to be much poorer than others as far as the across the population. Their food insecurity is going to be far greater, and so that is one of the challenges that starts off in the rural areas. The other thing in the more rural areas is resources are not there, and whether it's local community programs or governmental programs, transportation is first and foremost. How do we get access to the resources that are available to them? So that is very, very difficult in the rural area. One might say that in the urban area that there would be more resources. Hopefully there would be more resources. Hopefully there would be transportation. That's not always the case. It varies from community to community. In the frail, elderly, homebound, extremely needy population that we're working with, that are behind the closed doors, we're not sure exactly what we're going to find, and that is the same whether it's in urban or rural, because many times by the time we discover what's really behind that door, it's often too late. So it's challenges in both spectrums.
Right. Thank you. I yield back.
Thank you. The gentlewoman from Arizona, Ms. Kirkpatrick, is not a member of the subcommittee, but has joined us today. Pursuant to Committee Rule 11E, I have consulted with the ranking member, and we're pleased to welcome her to join in on the questioning of witnesses. So, Ms. Kirkpatrick, 5 minutes.
Thank you, Madam Chairman, and thank you for allowing me to participate in this hearing. I thank the committee for having this hearing. I represent a very large rural district in Arizona, and hunger and food insecurity are major, major problems. I visit the food banks in my district and the food kitchens, and one of the things I've observed over the years is younger families with children coming in. They're underemployed. They're talking with other people there about where they can find another job to help them get off of assistance. And I think often about hearing from a pediatrician several years ago who said that she's seen more malnutrition infants than ever before because the parents are diluting formula. And I have a 7-month-old grandson, and I know what a voracious appetite he has, and it really saddens me that parents are having to make that choice. And so my first question is for you, Ms. Liebman. I want to ask you about the Family Subsistence Supplemental Allowance, FSSA program that was set up to help our military families. I know some of these families I'm seeing are military families or veteran families, and that program is set to sunset. And so I have 2 questions. Why didn't that program work? And what are we doing to make sure that these families who are struggling to put food on the table have the assistance that they need?
When FSSA was created, it was created to serve more of a political purpose than a practical one. And it has been designed in its application process and approach to really deter people from accessing it. So you have to go through the chain of command in order to receive FSSA. And for many people who are currently serving in the military, not only is that simply not an option for them, they want to come in and speak to the commanding officer of the base.
Can you elaborate a little bit on that chain of command? Is it just one person or multiple?
No,
people?
you must go all the way up the chain of command to the top ranking individual on the base. In part, you often have to do this because the individuals whom you normally would consult about support and assistance, the chaplain's office or other kinds of in the Air Force, it's the sergeant majors who serve more as that access point. They don't even know that there's a program called FSSA. Some of them don't even know that active duty military members can apply for SNAP. FSSA is very similar in its support to what SNAP offers, but accessing it can be very challenging for these active duty military members. So there could be ways to fix it. The benefit level could be adjusted so it really was truly serving the realistic needs of members in the military. The application process could be streamlined, but the recommendations that we've seen are to sunset it, and we understand that, but it means that making SNAP not only available, but making individuals on the base aware of the fact that SNAP is available to active duty military members much more of an imperative, because it will become their lifeline for support, especially at the lower ranking enlisted levels.
And what's being done to streamline the SNAP process? I mean, that's going to be what they have to rely on.
Yes.
Are we educating them? Are we streamlining that process to make it better for them?
There's certainly a great deal of outreach that's being done. I know that one of the reasons that for Mazone this became a really priority issue was to do some outreach in addressing the lack of awareness about SNAP and its availability, but the most important fix that we see as essential here is the treatment of BAH in the way that it is treated for other federal nutrition programs. That is, that it must be excluded, or the ability to access those benefits will be moot because nobody will qualify. It is an inconsistency in government policy and law that really needs to be corrected.
Thank you. I have just about 30 seconds left. I want to ask really quickly. I represent 12 tribes in my district, and food insecurity and hunger are huge issues for
Yes.
tribes. And can you just quickly, in about 20 seconds, tell me what you know is being done for tribal communities?
I know that hunger and food insecurity among the Navajo Nation is at 75%, which is outrageous. There are programs and organizations working with government to try to address these problems that are not only systemic but deeply rooted. And as many of these subpopulations are, it is a complicated and challenging set of issues that have to be looked at and have to be addressed.
Thank you. I thank the panel. I yield back. I thank the chairwoman and ranking member for your courtesy.
Thank you. The chair now yields to Congressman Crawford for 5 minutes.
Thank you, Madam Chair. Ms. Liebman, I want to go back to the question that Ms. Kirkpatrick raised. And if I understand this right, walk me through this. You're saying that a junior enlisted person would have to ultimately meet with the installation commander to get authority to participate in certain benefits?
They don't have to go all the way up the chain of command. What we've at least learned anecdotally is that it's often the case because those people that they normally would get information from and assistance from don't know. And so they check with up the chain of command. And that individuals have concerns about who is going to know that they have sought out these benefits and what that might do to their security clearance and what it might do in terms of their treatment by their colleagues and by their superior officers.
Ms. Tebbins, did you experience anything like that?
I actually never, in the 8.5 years that I was affiliated with the Navy, I never even heard mention of that program. I actually only learned of it about a year ago when I initially started working with Mazone, but I had never heard of it, even through other spouses or anything. I didn't even know it existed.
So when you started to apply for programs like WIC, which you mentioned that you availed yourself of, was that application made out off the installation, or was there an office on the installation that could help you get those benefits?
No, I went to our local WIC office, which was just a small office in our town, in like a private office building.
Right.
And
So administered by the county, so there was no installation liaison or anything like that?
No, and I know it can be different. Part of the problem is inconsistency between bases and where you're living. And at least in my experience, where we were when we went to the Navy Marine Corps Relief Society on the sub base in Bangor, all they really knew, and it might be different at other Navy Marine Corps offices, was just the Military Star credit card. That was the only advice they could give us.
Okay. Let me go a different direction here. You mentioned that you were on WIC for a period of time, and that once you improved your employment situation, then you transitioned off of WIC. Was that something that you just did on your own, or was there a requirement to recertify your eligibility at any point in time?
There was, when we moved from the Kitsap Peninsula over to just north of Seattle, since we were switching WIC offices, and they always, I think it's every 6 weeks you get vouchers, so you have to go in, and I forget the time frame for re-inputting all of your like financials.
It's kind of an ongoing certification process for WIC. Is that your?
Correct. Yeah, you're not like just given vouchers for the whole year. I think it's in 6-week increments, that might have changed from then, but it's very short increments of time. You get the bundle, and then you keep having to go in and meet with them about various things.
Okay.
And then when I got my full-time job, I was realizing that we weren't using as much of the voucher each time. So I just realized, I was like, I told them at my next meeting, I don't need this program anymore.
Okay. Let me ask you this. I'm a military brat, grew up on military installations, served in the military myself, and I know that at the time that I served, there was a thing called separate rations. So if you're an enlisted member, you would get a meal card unless you were married or unless you were on a special duty where you couldn't access the chow hall at specific hours, so you would be given separate rats. Does anything like that exist now?
I do. The only thing that I know of is
they might call it basic allowance for subsistence.
Yes, yeah. So the BAS, and which kind of it depends. Like, you know, if you're deployed, then you don't get it because the ship is feeding you.
Right.
But when you're back on shore, you do. So there were definitely times over the 8.5 years where sometimes we had it and sometimes we didn't have it, just depending on what my husband's point in his career was.
Thank you. I appreciate you sharing your testimony. And Madam Chair, I'm going to ask that you might consider maybe a joint hearing with this subcommittee and Armed Services to address the nutritional issues that have been brought up in this hearing.
Absolutely. Thank you. Chair recognizes Congresswoman Luan Grisham for 5 minutes.
Thank you, Madam Chair, and thank you to the panel. I actually really appreciate we're going to have a joint colleague effort here because the statements that my colleague from Arizona, Representative Kirkpatrick made, and then my colleague from Arkansas, Representative Crawford. In New Mexico, we've got permanent SNAP lines at the commissary on the Air Force Base because we've got such high poverty rates and such high other issue rates that it's more commonplace than it should be, and it really speaks to a larger problem. We certainly want to make sure that folks who are entitled to those benefits get those benefits, and that we don't put the kind of barriers in place that those families are food insecure, but it speaks to a larger problem that we need those benefits for enlisted personnel in the military and in so many other work environments in this country. And I really want to thank Maison for working with so many New Mexico partners, including the Center on Law and Poverty and Appleseed and Roadrunner Food Bank, because as this committee, I think, knows, because I state it all the time, and I keep hoping that there's going to be sooner rather than later a position for me here where I get to say that those rates are dramatically changing in my state. But we have some of the highest hunger and poverty rates in the country, and as a result, looking at different populations, we're now really struggling with the veteran population as a subset, and the high rate of food insecurity. And I think that the Roadrunner Food Bank has told me that that 26% of the clients that they're serving, that at least one member of that client household is either serving or has served in the U.S. military, and that in our state, the unemployment rate for post 9/11 veterans is nearing 10%. And I think the trend, unfortunately, is that it's growing, that we're not shrinking that. And while 50% of New Mexico veterans are employed after they exit the Veterans Employment and Training Service, which is great, the average reported salary, again, and I know that there's been some conversation about the cliff effect, still makes a family of four eligible for SNAP. And you highlighted in your testimony the number of military families that are frankly in danger of losing their SNAP benefits, and that you're expecting 60,000 veterans to lose their benefits because of the expiration of the work requirement waivers for able-bodied adults without dependents. And I'm very concerned about that very same thing, where New Mexico's got a higher per capita average of veteran populations in our state and in my district. And despite our severe economic issues in New Mexico, our governor's not only chosen to reinstate the work requirements as of January 1st, but is also planning to expand them now to include people aged 16 to 59 and parents of children over 13 years. I have no doubt that this is going to further exacerbate the problem that you've testified about, and it means that you never get a chance to become whole, these families, and that we're not really addressing that opportunity aspect, if you will, by making sure that you have that your basic needs are met. Can you tell me what we can do here as a member of Congress to really think about the rate balances, because I don't think we do that very effectively, right? So, we want folks to get work opportunities, and we don't want being eligible for public benefits to create an environment where you're not succeeding and moving ahead. We don't want to create a requirement that makes you choose between that job or any job or no job at all and those benefits, and exacerbate these poverty issues and stigma issues. What can we do to create those balances more effectively and recognize the populations that we really are hurting?
I think that one of the challenges of having to access and rely on government benefits is whether or not those benefits are enough to provide the kind of financial stability that you need to move your family out of poverty, to provide the kind of security that you need in order to get an education, get a well-paying job, the jobs that people can access that are readily available in many communities are pay below a living wage, which means that people cannot get off both assistance and maintain the job. So the challenge of the limitations on how long you can be on benefits, what the benefits are actually paying you, plays into a system that doesn't provide adequate childcare or subsidized childcare, so both parents can't work. For households that are headed by single parents, particularly those headed by women, those challenges are exacerbated by other kinds of barriers to getting gainful employment. So that the complexity of the interplay between these issues means that Congress needs to take a good hard look at securing the level of benefits at a rate that provides people with financial stability and is a realistic safety net that allows them to get security and then move off of benefits. For those for whom gainful employment is no longer an option because they are either disabled or they are too senior to work, then we need to think about systems and how those play into other kinds of supports that allow people to live with dignity as they age. and they can provide themselves and their families with the kind of support that they need.
Congresswoman, one of the things we're really concerned about at AARP is any attempt to expand eligibility requirements so they really negatively impact people above 50. There's some talk about, raising eligibility to 59. And people in that age category have a much harder time finding new employment. That's been demonstrated. So any increase in the age requirement is going to be very harsh for those included.
Thank you. I yield back.
Thank you. The chair recognizes Congressman Budnischek for 5 minutes.
Thank you, Madam Chairman. I would like to thank the witnesses for being here, particularly you, Ms. Stebbins. I really congratulate you for the courage to be here today and talk about your story.
Thank you.
I am a firm believer in public-private partnerships and really believe that many of these nonprofit groups that, such as you represent here today, are very helpful in knowing more about the individual than the federal government does, and able to better figure out the milieu in which that individual lives and how to best help the people that you are serving. So I believe that leveraging federal dollars to help people like you and other groups too is really the best way to help people. I represent the northern half of Michigan, which is a very rural area. It's very low income. We have a lot of veterans. We have a lot of seniors. So the things we're talking about here today at this subcommittee are very pertinent to where I live. And I'm also on the VA committee. I'm actually the subcommittee chairman for health, and I like to talk about our veterans a little bit. Private organizations working to help feed veterans could use a little help from the VA, I think, and I'd like to learn from each of the representatives of the organizations how they work with the VA currently and what can be done either with SNAP or with the VA to make this easier for you all to help them. Ms. Liebman, would you start in trying to address that?
Absolutely. We have done a webinar training for VA social workers and caseworkers, and we're about to do another one. We have been working with the VA to help them communicate with and partner with the USDA, especially because there's so much overlap between the issues of nutrition and health, and the access points for many veterans into the system have to do with their disabling conditions and or their health conditions, and to make certain that those health professionals understand that there are resources available to help support the nutrition of those vets that are coming to them. The VA alone can't resolve all of these challenges, and I think that that's why we're here to look to Congress to make certain that there is strong direction here that looks to supporting those institutions and those government programs that are designed to provide them with adequate nutrition benefits, and that lies here with Congress.
Mr. Ferris, do you have any input on my question?
The relationship with the VA can always be improved. This past year, I think there was something like 500,000 veterans that were served in Meals on Wheels programs. Depending on where the program is located, it will be higher and lower. In our situation, we're located just south of Dallas and Fort Worth.
Does the VA help you then? Does the VA contribute to the funding of this?
No, sir.
No. Mr. Steinlein, do you have any comment?
Well, I'm glad you raised the issue of public-private partnerships, because one of the things that we've tried to encourage is the increased uptake of fresh fruits and vegetables. And we've got this AARP Foundation working with not only local farmers markets, but food retailers to pilot programs where the individual citizen recipient of SNAP could go in and get incentives, private incentives in effect, to purchase more fresh fruits and vegetables from local vendors and also supermarkets. And we've had great success with that, and what we're looking toward is to encourage, the private sector to help us improve the health of recipients through increased use of fresh fruits and vegetables. So we think that has a lot of potential to improve health over long term and utilize the private sector.
Mr. Ferris, I'd like to also ask you another question. We just have a minute left or half a minute. My district is very rural. Is your area rural as well? We have a lot of difficulty with elderlies, people living remotely.
Yes, sir.
How does that work?
We have roughly a 1,700 square mile service area where I am. Approximately half of it is suburban, the other half is extremely rural. And it is almost like a step back in time when you get down some of those county roads out there, and it's extremely difficult. Some of the more rural routes we have, it may take an hour and a half to 2 hours to get to some of those, compared to what in Arizona or New Mexico, ours is a very small expanse compared to there, but it's quite difficult, adds to the cost, and it's a challenge.
Thank you. I'm out of time. Thanks, Madam Chairman.
Thank you. The chair recognizes Congressman Abraham for 5 minutes.
Thank you, Madam Chairman, and certainly thank the witnesses for being here. Ms. Lehman, I'll direct this question to you, but Ms. Tibbins, you can surely jump in with your experience. As you recall, the 2014 Farm Bill did include some funding upon existing SNAP employment and training programs and to test some new strategies to determine the most effective ways to help SNAP recipients gain and retain employment that leads to self-sufficiency. And I was pleased to see that the Washington Department of Social and Health Services was awarded a grant through this pilot program to help individuals with significant barriers, including veterans, through comprehensive case management and work-based learning opportunities. And many of these jobs that these men and women performed overseas are very difficult. We know that. And they're very different from the employment opportunities that we have here at home. What can you tell us about the unique nature of the employment challenges some of our veterans face?
I think that it's important when we think about this question and these issues to bear in mind that the age range of veterans is extraordinary. It is not only individuals who have just demobbed and are in their 20s, but it's also people who served years ago and are categorized as veterans because they served our country honorably and are now in their 50s or 60s. And as my colleagues here from AARP and Meals on Wheels testified, the employment opportunities and access points for individuals who are in their 50s is very challenging. So you have a population that is not homogeneous. You have a population that is for those who are younger and getting demobbed, they're getting demobbed in locations that may be unfamiliar to them. They may not be able to go home. They may not have family support systems. They may be in situations where they are getting retrained for jobs and there are no opportunities, or those opportunities are being filled by people other than veterans. And there are the same kinds of challenges for those who have other kinds of employment challenges that exist for veterans as well, but is complicated by the fact that they have been overseas at some period of time in their lives or been on base for some period of time and now coming back into civilian population.
Okay, thank you. Ms. Tibbins, do you have anything to add to that?
In terms of veteran employment, I'm not really sure, but in terms of spouse employment, I know it can be really difficult because especially if you are in a position like I was as a teacher, or I have a friend who's a lawyer, or many other friends who are teachers or maybe hairstylists, anything that requires a license from the state. When you move every 3 years, it can be very difficult if you have already had a really good career going or a client base or anything like that, and then you up and move. A lot of times you are not only starting over, but if your new state does not recognize that license, which is also often the case, it can be a huge impediment.
Have to retake the exam or something like that.
Yeah, retake the exam, or various things, which can also be very expensive and very difficult when you're also trying to situate your children in new schools and things like that. And for instance, where we moved to the Kitsap Peninsula, which is right across from Seattle is very small and often very rural, and there is not a lot of opportunity. When we moved across to Everett, I was able to get a really, really excellent job, and then we were fine. But I would have had to commute over to Seattle while we were living on the Kitsap Peninsula, which was difficult because we had one vehicle and a newborn. So, and that's like about an hour away.
Okay. And Ms. Libman, one last question. If we run out of time, you can certainly reach out to me afterwards. Going through this child nutrition reauthorization, we've been successful in identifying ways to streamline and improve child hunger programs with the goal to make them more effective and more efficient. We have a child nutrition safety net that makes meals available during the summer and after school to all children who are eligible. What recommendations would you identify to improve and streamline these hunger programs, such as SNAP, for our seniors and veterans to make them more efficient, effective in reaching and providing services for our hungry seniors and our hungry families?
In terms of the military, I would just say that even just informing military members that they might be eligible for any of the programs is really, really important. And then in regards to SNAP, removing the BAH component like they do with the WIC program. And I actually did last week, I just wanted to check and see if I was in this same exact situation I was when I was pregnant, if I reconfigured it for now with SNAP, what we would get. And if I omitted the BAH and also zeroed out all the costs for housing, it would still only be $66 a month that we'd be getting. So not a huge amount of money.
Thank you. I'm out of time, Mr. Chairman. Thank you.
Thank you. The chair recognizes Congressman Yoho for 5 minutes.
Thank you, Madam Chair. I appreciate you all being here. This will be the last questioning, and I come from the state of Florida, and as you're probably well aware of, we're the third largest in the country. I live in a district that it's the second largest VA community in the country. It's got over 121,000. And, you know, people joke, Florida is the state of the newlywed or nearly dead. I don't know how you want to take that. But, you know, we serve a large area. We've got rural, and we've also got a lot of military veterans, as I've talked about, both retired and active. And we've checked with our office for this meeting, and we get 1 to 2 inquiries about every other month for food assistance. And of course, we automatically deal with them. And I can relate to G.T. Thompson because we've been on a WIC program, my wife and I, about 100 years ago in our youth. And I know the importance of those. And Ms. Liebman, you were talking about, you know, there's 2 to 22,000 veterans estimated of needing food assistance. And I was looking at the numbers in here, and my question is, why has the participation been so low? And I know we've covered a lot of that, but again, you know, I'd like to hear your answers of why you think it's so low. Is it underreporting?
Well, the 2 to 20,000 figure is active duty, the currently serving, that's the estimates of the currently serving that are on SNAP.
Okay.
And so that the numbers, so one of the things that we saw as a challenge when we began this work was that it's very difficult to get complete and accurate data, and that's why you could have a span of numbers that is quite that large.
Okay, I want to cut you off there. As I did your numbers here, and you went to the survey, the Blue Star survey, which I've got pulled up here. When I look at the numbers, it said it was, I think, 7% of the 2015 reported more than 7% responding active duty military and spouses face food insecurity. And if I take that number of the 19,455 active duty, that comes down to 1,362 individuals. And I guess my question is this a program that we need to expand on a federal bureaucracy, you know, and increase the bureaucracy, or is it simpler to go into the military and say, you need to pay these people more?
So
And I want to go to Ms. Tebbins after this.
Far be it from me to suggest that the military should not pay people more money. I do think that would be an important aspect of the entire picture here. But in the interim, until that would happen, and for those people for whom those additional funds would not be adequate enough to cover their family's needs, the military does have a responsibility to make sure that its members are aware of and given access to the federal programs that the rest of America accesses and enjoys as a part of our rights as citizens to be relying on our government to help us when we are vulnerable. And the challenges here aren't, the numbers do not tell the story yet because we do not have accurate and complete numbers.
I lost my microphone. I agree with that, that we need to make sure people are getting the assistance they need, but I don't want to go down the road of increasing and growing a government program when there's a simpler solution. You know, the government's not always the answer in this. And Ms. Tibbins, in your experience, and you alluded to this, that you guys moved how many times?
Oh, gosh. 3 different duty stations?
In how long, 8 years?
Yeah.
All right, 3 different duty stations, and I understand the disruption of the workforce, and you were trained, you're a school teacher, correct?
Mm-hmm. I was, yes.
Okay, and so in that, each time you move, I understand there's a transition period that you have to go through, and in dealing with what you were talking about, cosmetology and or any other field, if you're not licensed in that state, we've addressed that, and we've passed legislation to look at reciprocity between the states, and I think that's something that can solve this. In your active duty and your husband as a military family, did you get a food allowance? Because I know in the Coast Guard they get about $350 per month in food allowance. Did you have that, and does it go up with, you know, the size of your family?
I don't recall if it increases with the size of the family. What I do remember about the BAS allowance is that it really hinges more on the active duty person and where they are in terms of being currently stationed. So for instance, if my husband was around and just working on the base, we might get a few $100s a month, let's say. But then if he is deployed, the military is looking at it as, well, the galley in the ship is feeding him. So because it's not really, it's more like for them to be eating and not, I don't think so much for the whole family. And so when they're gone for, 7 months on a carrier and that is removed, then that could be a couple $100s out of the larger family.
Okay, and I appreciate you guys coming here because those are issues that we need to address. We just want to make sure we do it the most efficient way to serve the families of our military. And I'm sorry I didn't have time to go to the elderly since I am one now, but I appreciate you all being here.
Thank you. I appreciate the panel's help in understanding the challenges faced by seniors, veterans, and active military members. There are indeed special populations that we must consider as we look at ways to strengthen SNAP and the other food assistance programs. You've certainly given us plenty to think about as we continue to look at the past, present, and future of SNAP. No program is perfect, we understand, and we can always do better. Under the rules of the committee, the record of today's hearing will remain open for 10 calendar days to receive additional material and supplementary written responses from the witness to any question posed by a member. This hearing of the Committee on Agriculture and Nutrition Subcommittee is adjourned.